Dr. Pascal Harrison presents Parenting Through COVID-19.
Hello, my name is Dr. Pascal Harrison and I'm going to be talking about being a parent in lockdown and some of the challenges that you may be facing at this moment in time. I hope this short web seminar finds you all well and you keeping safe. Over the next 25 minutes, I'm going to be talking about how you might be able to communicate about COVID-19 and other illnesses. Also, a little bit about how to have structure and routine during this time, and also about the challenge of working from home when you have children. From the very start of lockdown, it's caused lots of disruptions for many children and for adults as well. Majority of people have had their routines changed by not being able to go to school, nursery, college, not being able to anticipate any future events coming up, being able to stop doing their sort of normal activities of football, swimming, whether they may go to other classes. There's been lots of change for children, and some of this may have created some uncertainty and possibly some threat about what's going to happen in the future and what's going to happen with their family and friends. And as human beings, we all need that feeling of feeling safe, being able to have our basic needs met. And in this diagram, we've got Maslow's hierarchy of needs, which looks a little bit about what we need as humans. So what we need is to be able to have our basic needs met of being able to have food, water, shelter, clothing, being able to sleep somewhere safe. And then the next part is thinking about our safety and security, so to be able to have our health, our employment, family and social stability. And as we go up, then we have the love and belonging, being able to self-esteem, and then being able to be in the point where we can be more creative. During this time, it's been really difficult for people to be able to feel that they have their routines stable and have aspects of their lives that can keep on continuing during this lockdown period. So for some children, this can generate some worries of not feeling safe, even if before the lockdown period they may not have felt anxious. So one of the main things that for our children is to help them to feel safe. And for them, one of the most important things is to be able to feel secure and valued at home. So all your child wants is a calm and safe environment. So thinking that we may already had some talks with our children about COVID-19 or other illnesses, and this may be something that you are sort of thinking of doing in the future, especially if some children are planning to go back to school. So there's some key groups that will be returning to school, like perhaps nurseries, year 1, year 6, and so there may be some children that are thinking about going to school or going back into nurseries, or there may be some children that have already been doing that if you're a key worker. So thinking about how we talk to our children, you will know what's best for your children, how to be able to tailor this. But this is just some possible advice, thinking about the different age groups of your children. So being able to talk to 0 to 3-year-olds. For some children, they may struggle to understand about viruses because this is something they can't see and be able to touch. And they may not have had the concept of what illnesses are. They may only have understood it from the illnesses that they've had or people within their family have had. Some possible suggestions of how we might be able to talk to children are to be able to use short, focused sentences that be able to explain the here and now. So thinking about any disruptions to their sort of basic needs. So for some children, they may have had changes if they were at nursery or were going to other family members, and how that might have changed their routines, like for sleep, eating, those that they have close relationships. And it may be worth looking about that aspect of how it affects them. And part of it is being honest and keeping explanations brief. So we won't be able to see Granny and Grandad this week, but we'll be able to see them soon. As we sort of move up, thinking about talking to 4 to 7-year-olds, their sort of understanding of illness has increased. So they sort of understand more about having a cough, a runny nose, because they may have experienced this, or they may know family members that have, but they still may not have understanding of COVID-19. And one way of being able to talk to 4 to 7-year-olds about COVID or other possible illnesses during this time period is to think about how you might be able to incorporate stories into this, or be able to look about play. And as we go through the slides, there's some suggestions of books that people may be able to access to talk to their children more about COVID-19. There's a whole heap of different resources out there to help you to be able to do this. And another part of it may be looking about how we try and prevent and stop the spread of COVID-19 by talking about washing our hands and how that can help with reducing germs. Also, maybe encouraging your child to be able to label and name any of their emotions, and perhaps being able to describe how you are feeling. So being able to talk to children. So as we move up to 7 to 12-year-olds, they will have a much greater understanding of illness. They themselves would have been poorly. They may have seen other people that have been unwell. They're more likely to understand the guidelines and rules that currently are in place at the moment about social distancing, being able to keep that 2 meters apart, being able to wash our hands if we were to cough or we were to sneeze, and they would have greater understanding of how that might be able to help us prevent this spread. And also they may have had to take medication before due to illnesses, so they may have some understanding about illnesses and how it can affect people. But also this age range, they may sort of understand that with COVID-19, there is that possibility of a small percentage of people can have a much more severe complications of COVID-19 and could possibly pass away. So they may sort of understand more about death and more of the more severe cases that may have been presented in the media and what we see sort of hearing about the death totals each day. So children also at this age may need to have some encouragement to be able to express how they're feeling and be able to normalise how at the moment this is a really uncertain period of time, and it's completely normal to have a range of different emotions, to feel anxious or worried during this time. Also being able to think that some of the symptoms of COVID-19 are part of other possible illnesses, and is thinking that coughing may not always mean that this is something to worry about or that person may have COVID-19. As we sort of move on to 13+-year-olds, teenagers often have a much better understanding of illnesses. They understand the cause and effects. And this age group, they may be looking at their own resources. They may have gone on different apps and may have gone on Google. They may have researched the information that's already out there or been able to look at news. So they may not require our sort of need to be able to help them sort of understand about it, but it may be an opportunity to have a discussion and being able to ask them what do they think about the news and what do they think about the risk for COVID. They've been able to ask them and be able to offer some support. And if people are worrying, is there perhaps a way of helping them cope with their worry that helps them to feel more positive? So these are just some possible suggestions, thinking about tailoring it to your individual child depending on their year group that they're in. So in summary, think about how we communicate and talk about COVID-19. Here are some of the 5 top tips. Being open and listening, to be able to give space for your child to ask questions and be able to ask open questions, find out how much they already know. Being honest, tailor the information to the age of your child, and remember it's okay to say I don't know, and perhaps you may say I don't know, but should we go away and have a look at this? Be supportive. Give your child space and time to share their fears and worries, and to be able to give them that time where you may not be having any other distractions. And trying to have a stable environment will help your child to feel more safe during this really uncertain period of time. Choose reliable and trustworthy sources. It may be worth having a look at where you access the information, and at the end of this presentation there's some useful resources that you can always have a look at if you'd like to gain more information about talking about COVID or being able to understand a bit more about it for yourselves. And so trying to be able to end on a positive note. So being able to have that reassurance for them and being able to ask them any questions if they want to be able to talk. And I realise talking about COVID-19 can be quite a unhappy or can be quite a distressing topic to talk about for children. So maybe thinking after this, is there something fun and enjoyable that you may be able to do that actually might remind them of that pre-COVID-19 time before in this lockdown, something that you may have done before all this happened. So one of the things we may all be struggling with at the moment as we're in lockdown and nurseries and children at school may not be going is being able to think about how to have that structure. So we're going to talk a little bit about having that sort of flexible routine and how this might help at the moment. But I imagine you probably have worked out some structure, but this is maybe just some other suggestions. So being able to have that consistent, but also being able to be flexible in your routine. So some possible suggestions may be to have a visual schedule. So this may possibly be drawing up a timetable and being able to put the things that are going to be important to have within your day. I realise if you have school-age children, there may be work that they've been sent home from schools, and this may need to be put in as part of your day. So maybe thinking about having that set start and end time and having those breaks, as children from nursery through to school age would have all have had a set start, end time and have breaks and time for play. You can always include your child in to be able to contribute ideas to the schedule and being able to add in more fun activities within that and thinking about how they would have had their school routine. They may have ideas about what times they normally have breaks or when they have their lunch, and so maybe asking them how they can input into the schedule. It may be looking at putting any activities that give them a sense of achievement, and it might be looking at learning a new skill, such as being able to cook or gardening, as an opportunity that you're able to try new things. And this has been trying to be flexible, because there may be some days where people and yourselves and your children may be worrying more than what they would do, or they might be missing their friends or their family members, and it may be just having some flexibility in that routine. And it's looking at being able to celebrate some of those achievements they've done in the day. So what have been some positives of what you have done that day? And if you're able, for some younger children, it may be looking at celebrating some of those positive behaviours that they've done. So how do you keep routines positive? And part of that is that we could try and role model some of that positive, calm behaviour with our children. And they may be thinking about the kind of language that we might use for our children. So one suggestion, if children do make a mess, it may be asking them, please, can you place your toys into a toy box? So maybe thinking how we communicate with them, what kind of language do we use with them? And I'm aware that we're all juggling different roles, and having that time with our children can be really difficult to be able to do. But being able to perhaps set some time with them, whether that's 15, 20 minutes, but being able to have that activity you might do with your child. And some suggestions may be to turn off other devices so you can be present with them and you can enjoy that activity. And being able to ask them for any input of what they'd like to do. I realise that we're all going to have children of different ages, and when it comes to older children, they already may have ideas about their routine and activities they want to do in their time. So we may be looking at ways of how you might encourage older children to engage with the family, and whether there's activities you can do as a whole, and that they may be able to join in with you as well. But ultimately, schooling is not in the classroom. I'm aware that there's going to be lots of work coming their way when they're off from school, different maths, science, English, RE, whatever they may have to do from school. But also it's a really good opportunity to learn some life skills, and they may be looking at some of those things you may want to try at home. For some children, this can also be a really difficult time where there may be some more challenging behaviours, and for different age groups this might be demonstrated in different ways. So I'm going to have a look a little bit about the different age groups and some of those behaviours that they might show. So for infants aged 2 to 2 years old, we might notice that they're more likely to become distressed by change, especially if they may have been going to family members or maybe going to nursery. This can be quite a dramatic change to not be involved with any key workers or family members. So then you might notice them becoming more clingy, or they might have noticed them becoming more tearful and upset. So when it comes to children from 3 to 6 years, this might be a period where you might notice them going back to behaviours they may already grown out of. So this might be examples of bedwetting, having difficulty with potty training. It may mean they have more anxiety when they're separated from you. And possibly there could be increase in tantrums and being able to express their emotions more than normal. As we sort of get into the older age groups, we might see a different range of behaviours, and they might all show a different range of emotions of feeling anxious, angry, sad than usual. For a lot of children, this may have completely changed their worlds of not being able to be at school and do all the activities they may be doing outside of school. And so they may feel really anxious and upset that they can't carry on being able to see their family and friends. So possibly we could see children become more talkative if they're more worried and anxious, or potentially may become more withdrawn. And thinking about those at age 11 and over, this may mean they may show a whole range of different emotions depending on how it's impacted upon them and their situation and the worries they may have. But potentially children of this age range may be more irritable and may feel more uncertain about how they might express themselves. This potentially might mean they might withdraw from being able to interact with yourselves at home and also with family and with friends. And we might see them sort of acting this out in other behaviours by not being able to help you in the house and being able to do things they normally would have done quite happily. So how do you help with this? Because I realise this is a difficult time for us all. How do you manage those challenging behaviours? So some of the suggestions are to take time to pause and not react immediately. So being able to take 5 to 10 slow, easy breaths and then try to respond calmly. Notice when you have other stresses going on that might make you more irritable. Redirect your child's focus. So try to notice those early signs of restlessness and distract the child with fun activity. Use consequence and give choice. So consequences create boundaries, encourage children to take responsibility. So be able to give your child a choice to change their behaviour before giving them a suitable consequence. So this might be putting them in the calm down space, or as with older children, you might be taking away their devices. So keep the consequence realistic. So removal of Wi-Fi access for 1 hour rather than 1 week, and try to follow through with it. And then once perhaps they're over this period, is trying to really reinforce those positive behaviours that they may be doing on a daily basis. So the next section is thinking about how do we manage working from home. So for many of you, you may be working from home or maybe trying to juggle the homeschooling. So this is an area that we all might be struggling with. As a mum of two, this is something that I experience on a daily basis, trying to be able to manage your children and being able to work from home. So you may start to feel a bit zoomed out, as you may be sitting in many teleconferences meetings in your day, but you're still trying to work from home and juggle being a parent. So how do you do this? You may already found some really good ways of being able to do it and being able how you juggle this. Depends on the age of your children and whether you have one child or you have more than one child at home. So you may have found some good ways of being able to manage this, but here are just some other suggestions that you could try. So one suggestion is have a period of focus. So you focus on one set piece of work and be able to have breaks. Have set meal times and breaks so you can have time away from doing your work that you can spend with your family. Perhaps consider having a workspace so you feel that you can have that specific space that you can undertake your work, but then you can move away from it. So I realise it can be really difficult if you're trying to work with having your children around you, running around you. Having some respite. It can feel, if we're working from home and not having our children, we may not get that designated time period where we can just think about ourselves and just be able to have some time alone for ourselves. So maybe thinking how you might incorporate that within your day. Also being aware of our perfectionism. Sometimes we might set ourselves the same standards as we might have had when we were working in the office or other environments. And I realise at this moment when we're trying to manage our children at home and trying to work, this can be really difficult to be able to keep to those high standards. So it's just been aware of being able to be kind to yourself and being able to think that there may be some days where it's more difficult than others. So other suggestions about working from home, and one possible is almost having like a traffic light system. So you have like coloured paper, and you can, if people come to disturb you, you could show them this paper to be able to say not to be disturbed, or maybe you have this on the door of the room that you're working in, so people sort of know this is a time not to be disturbed, and then it's a time where it's okay to be able to come and interrupt me and show a picture that they may have drawn. Perhaps this might be more for those older children, but it's thinking, how can your children have more responsibility, and how can they help you with things in the house, be able to make lunches, how can they support you with things at home, and also this may help them to feel more independent and have more confidence in some of those life skills. I suppose it's a time where we may need to be more creative of how we juggle work and home, and it may be asking other people for some help. So possibly family members or friends may be able to read a story via Zoom, or may be able to talk to them through Skype or other FaceTime, and they may be able to occupy your child for a period of time whilst you're able to do some work. Another option may be virtual play dates where other children can entertain your children. So this gives you an opportunity that you can get on with your work whilst your child is being able to have some fun. And online physical exercise classes also can be good to help entertain our children. So I realise it can be really difficult to be able to manage the stress of working from home and juggling your children. And the exercise is looking about how do we manage this stress. The stress can be a normal experience that tends to happen when the demands placed on us exceed our resources for coping. So we sort of find ourselves that our resources outweigh the demands on us. and then our demands then become too great that our resources are able to cope. So then we can then feel quite overwhelmed by the stress. And life during the current COVID-19 can feel particularly demanding, and it can exceed our capacity for managing stress. So some signs of possible stresses that we've already perhaps talked about, maybe the pressure of homeschooling, change to our sort of normal ways of being able to cope, and being isolated, not being able to see our family and our friends as much as we used to, perhaps having some health worries. Or for a lot of people, this has had a massive financial impact upon people, especially if they've been furloughed and not been able to continue with their job. So this might be causing some financial and employment worries. So how can we manage stress and isolation? So try to identify the source of your stress. To be able to talk through some of the stresses with those that are close to you, or perhaps with professionals. And we can use sort of the worry tree, which is a way of being able to think about, is this something that we can take some action for, or is this something that we can't actually solve at this time and we may need to let this go? It may be to practice the 4 A's of stress management, so trying to avoid any unnecessary stress, to be able to alter. So can the situation be changed? Adapt. Can you adapt to the situation and accept the things you cannot change? Try to maintain a healthy lifestyle and get moving. So it's just thinking about how we can keep doing those physical exercises and how we can look after ourselves. And trying to stay connected. I realise it's a difficult time where we used to see family, friends face to face, but it may be a way of being able to still keep connected, but be able to do this more online and through Skype, or by being able to see them through exercise outside. Make time for fun and relaxation. So being able to have that time where you can come away from any work if you're working from home or homeschooling, and being able to perhaps do some activities with your children, or be able to take that time for you, to be able to have that time where you might be able to relax just for you. And to perhaps look at time management and how to be organised, or how to keep that routine, but being able to do it in a flexible and structured way. So the next part, and the final part, is just thinking about some of that advice we may have been giving about COVID-19. So how are we able to stay at home and stay alert? So some of the suggestions are that we only leave when it's essential. So for our food, for health, or possibly if we need to go to work. It's trying to keep that social distancing of being able to be 2 meters apart, except for those that we live with. But now we're able to do unlimited exercise outside. But one of the essential recommendations is always to be able to wash our hands. So for some people, this may have caused some worries about accessing healthcare. Because I suppose at the moment we may see on the news about COVID cases in hospitals, and this may lead to people worrying about their children if they are to get poorly and whether to access healthcare. And Dr. Ranj, who is a GP and a BBC presenter, has put some following advice that could be really useful to be able to consider when we think about our children accessing healthcare. And also the Public Health Agency have also published some guidelines of what is deemed as being as being necessary to be able to send your children into a hospital setting. What would be amber and what would be green? So some of the advice is the children can still get coronavirus, but at a low risk of complications unless they have any underlying health conditions or have immune complications. Washing hands is still going to be important. I'm aware that we've had these messages of washing our hands right at the beginning, and this is still going to be important when children go back into education. Children will not be alone if they go to hospital and they do need to access healthcare. A fever does not always mean it's coronavirus. Possibly there's other illnesses that generate a fever, and we may need to continue to be aware of those possible risks. Be aware of rashes and keep up to date with those jabs. I think for some people, they may have worries about going to GP surgeries and having their children have those jabs, and it may be to keep up with those just so it keeps up their immune system. And the overall take-home message is the NHS is still open 24/7 if you need it and your child does become poorly. And as I sort of said, the Public Health Agency have published some guidelines of what might be sort of for parents to read during this COVID-19 lockdown about what is red. So what are the symptoms of your child's illness that you may need to be aware of, that they would need to access immediate healthcare, and then what would be amber, and then what would be green. So it may be useful to have a look, and there's a link of that in the useful resources. So thinking about those child-friendly resources, so if we are thinking about talking about COVID-19 with our children, and especially if they are returning into an education session, these are some of the possible ones that you may be able to access. A lot of these are available online, that you're able to do this without any charge. So it may be a really useful way to help facilitate having a discussion with them about COVID. And here are some useful resources that you may be able to access. So some of these are geared for children, that you're able to have a look with them. Some may be some advice especially for you to have a look at. But these are just some useful resources that will help you facilitate with your child, depending on the age group that they may be in. So thank you very much for listening, and I also would like to thank my colleague, Dr. Paul Sutherland, who originally put together these slides. So thank you very much, and I hope you all keep well and safe. Thank you very much.